started. So good afternoon, everyone, and I want to welcome all of you to our second webinar of the year, looking at the intersections of the root causes of violence. And these webinars are brought to you by the Pathways Statewide Steering Committee. So today I'm really excited to welcome our three panelists. So we have Darlene Trigg from the First Alaskans Institute, Margaret Hobart from the Northwest Network, and Christine King from the Centers for Human Development joining us. They're going to explore the intersections between racial justice, gender justice, and disability justice work. And it is our hope that each of you will walk away with a better understanding that inequities are experienced based on multiple identities, and that you will gain ideas and information on how to include equity work into your organizations, as well as better understand areas for possible collaboration and growth to expand your work to create equity across the various root causes of violence. So without further ado, I'm going to go ahead and turn it over to our panelists to introduce themselves and the work that they're currently doing. So Darlene, do you want to get us started?
Sure. Well, hello, folks. As you can see on the screen, I'm Darlene Trigg. I work for First Alaskans Institute as their Social Justice Manager in their Policy Center. I have just joined First Alaskans Institute in June, but I do have a standing relationship with the organization through various initiatives that they have, including the Racial Equity Project that I'm going to tell you a little bit about now. I'm Inupiaq. I was born and raised in Nome, Alaska. My family hails from Shusmaraq, Wales, and Little Diomede, and I do see some friendly names out there in the list of participants. So hello to all of you that are my Inuks, my family, my community members. So the project that I am responsible for here at the First Alaskans Institute is our Racial Equity Project. Our first phase of our Racial Equity Project began as we received funds from the W.K. Kellogg Foundation, their Healing America initiative, and we received funds to do work around racial equity with two goals. The first goal was to create policy recommendations around racial equity. And every 10 years in the general election, there's a question that comes up on the ballot. Shall there be a constitutional convention? And the Constitutional Convention would open up the Constitution for revision and change. So when we go back to the original Constitutional Convention, it had 55 participants, and only one person of those 55 was a person of color. He is actually Alaska Native from Southeast. When you think about Alaska and you think about our diverse population, the question that comes to mind is, what would a racially equitable constitutional convention look like, and what might that do for our state? And then the second goal was to reset the dialogue on racism in Alaska by having a dialogue. And the original grant had, in its original plans, we had planned on having 6 dialogues on racial equity in Anchorage. And early on in the project, it became very apparent that the project would benefit by training host members to host these conversations on racial equity. I am one of the original host members. There were 16 people trained and brought into the project. Through the 16 members, over the course of the 2-year project, instead of 6 conversations in Anchorage, there was 54 conversations in Alaska in 9 different communities using those host members. So we went above and beyond the original goal of hosting several conversations throughout Alaska. In this last year, we received a second round of funding for our project. Our original project, I should go back and say, it was Alaska Native Dialogues on Racial Equity. The second phase of the project is Advancing Native Dialogues on Racial Equity. We affectionately call it ANDOR, or ANDORE, if that suits you better. But this second phase of funding is about more than just policy recommendations. We actually have a larger scale project that we've launched. The 3-year project, we've just completed our first year. Our 3-year project has some focus areas in it. It is to continue hosting those healing dialogues, but we also intend on launching a collective impact project that has a focus on legal advocacy, education advocacy, and public advocacy. And all of the work that we do is grounded in our cultural values. So, you know, where most funders are looking to have a focus area on, say, for example, children or teens or parents or elders, this project really is focused on the entire life cycle of our community members. And the end goal of this project really is to advance equity in Alaska and have equity be a value of all Alaskans.
Great. Thank you, Darlene. And next we're going to turn it over to Margaret to introduce herself.
Hello, everybody. I am really happy to be here with all of you today. I'm joining you from the Northwest Network of bi, trans, lesbian, and gay survivors in Seattle. And before I came here, I worked for about 15 years at the Washington State Coalition Against Domestic Violence. So I'm going to be drawing from both kind of areas with examples and thoughts as we go forward. What I spent a lot of time doing at WSCDIV was working on child welfare and children affected by domestic violence related policy, and as well as like stuff about shelter policy, shelter access, shelter rules, and before that the domestic violence fatality review. But what I'm doing at the network now is really exciting. We are part of a national project and a national collaboration to spend 3 years with people from all over the field thinking about, like, hey, what about domestic violence in the LGBTQ communities? If we were to assist the field in improving their ability to provide services and support to LGBTQ survivors, what really do they need? What do programs like the programs that you all work with need to do your work more effectively with that community? What do LGBTQ organizations need to address domestic violence more effectively? What's a research agenda that would help us understand prevention and intervention in this arena more fully? And what's a policy, you know, what kind of policies do we need to help increase communities' strength and resilience and individual survivors' strength and resilience and help prevent intimate partner violence? So it's in this particular set of communities. So it's really exciting work. It's kind of very thinky kind of work right now, but by the end of 2016 we'll be rolling out some kind of recommendations and reporting on the work that we're doing right now. So that is what I'm up to here, and I'm very excited to be part of this conversation. Thank you so much for inviting me.
Thank you, Margaret. And now I'm going to turn it over to our third panelist, who is Christine King.
Good afternoon, everybody. It's an honor to be invited to be part of this discussion today. There's quite a few of you who actually know me since we've done some direct work with each other, and I'm very excited to talk about all of the awesome things that our individual communities are doing. But what I provide here at the Center for Human Development is, I would like to say, like, the disability voice in victimization and victim advocacy. There's a huge movement of not about us, without us, and so we want to be sure that individuals with disabilities who do have a higher prevalence of victimization compared to individuals who don't experience disabilities, that they're part of the conversation on how to have more inclusive communities and more inclusive services provided. And so what I do is I'm the project director over here for what's called the Disabilities Justice Initiative, which is a program that is sponsored by the Alaska Mental Health Trust Authority, and I'll go into further detail at the next question. But you know, I provide a lot of training and technical assistance for community providers to bridge the gap from victim advocacy and the disability community. One of the things that we know is that the individuals that victim advocacy are working with and disability providers are working with, they're common shared clients. And so instead of, and I'm so excited about this conversation of siloing, because that's all I do every day is how do we tear down the silos and instead of looking at individual programs with eligibility criteria that are so like black and white, how do we cross systems support each other and better support our folks in the community? And I provide the technical training and technical assistance and training in that perspective to promote inclusion in all of the different community provider systems. And I also manage what's called DART, or Disability Abuse Response Teams. And that is a multi-cross-system collaborative team approach in how to respond to any allegations of victimization within a local community. And it's been very successful, and I'll talk about some of the programs that we have across the state later on today. I'm also part of what's called ASPEN, or the Alaska Safety Planning and Empowerment Network, which is a statewide coalition of, again, multidisciplinary partners. So it's partners from ANDVSA, from the Alaska Mental Health Board, and the the Advisory Board on Alcoholism and Drug Abuse, the State Independent Living Council, the Council on the Governor's Council on Disabilities and Special Education, and us folks over here at the Center for Human Development, and how we are kind of walking our talk and creating a model infrastructure, and how we cross systems need to be better communicating with each other and streamlining our services so that we don't become barriers to the folks that we're serving in our local communities. And so we will go in and we identify a local community that would like for us to come in and provide them a needs, like a third-party needs assessment, to be able to look at their programs and see how that, if they're streamlined or not, and if there's gaps in services, how they can better support each other on a local level. But I'll go into more detail with the next following questions. But again, thank you for providing this forum so that we can continue to collaboratively work and support each other in this great work that we do for our communities.
Great. Thanks, Christine. So thank you to all of you. I'm really excited. You bring a wealth of knowledge and experience that I'm excited for you all to share with us. So great. So let's get started. I think really in order to understand the intersections across all of the root causes, it really is important for us to understand what the work looks like. So what is happening? Can each of you talk about the justice work you're currently doing and how it might possibly overlap with other areas? So we're going to start with you, Margaret.
Sure. Yes, I think that it's become very clear, that all justice work needs to be interconnected and have an interconnected analysis, and I think we really have tried to make that clear in the work that we do here at the Northwest Network, as well as the work that's done at the State Coalition Against Domestic Violence. So the question that I was thinking about is, what does gender justice work look like? And I think, sometimes it's helpful to think about, like, what is the end point, and like the ideal scenario around gender justice is that we have an understanding, that we have a common understanding that there has been something true about the way gender, which is that we've been forced by various cultural norms to conform to very binary definitions of gender, and that's been enforced in different cultures in different ways at different times, but it's been enforced. And it's been enforced to also benefit white privilege and other kinds of hierarchies, colonialism, so like, sexism, putting down certain forms of both masculine expression and feminine expression has been used to justify racist domination and imperialism, as well as just straight up, sexism and exploitation of women. So that is intertwined with, these other kinds of systems of structural oppression. So that is a true thing, but it isn't the truth about gender, that gender isn't true in the way we've been taught. And so in that way, gender's not real. It's just been mobilized as an idea to perpetrate hierarchies. So to me, like kind of the ideal endpoint is where we reach this understanding where we can look critically back at the history of how the idea of gender's been used and played out, and how, and be able to ask the question, how is sexism operating here? How is sexism and, homophobia, transphobia connected to other forms of domination here, like imperialism and colonialism and racism? And then kind of also be able to say, and that is real, that there's a system of gender oppression, but gender itself isn't real in the way that we've been taught, in that, in fact, if you just look at the human, human history, cultures across time and space, that there's, this gender binary idea is false. There's like a much broader and more diverse expression of gender than what the dominant model allows us to think about, and that there's no reason to divide it up into these qualities go here, these qualities go there, and nobody gets to cross lines. So to me, I think that's sort of the end point is where gender is really not that important, but that we can identify, but we can recognize the ways it has been important as part of systems of organizing the culture in oppressive ways. So what that means here at the network is that we are addressing intimate partner violence in all parts of the LGBTQ community. So we serve people who identify all different ways with regard to gender and are being abused by partners who identify all different ways with regard to gender. So we're serving people who are trans, we're serving lesbian women, we're serving bisexual women who are battered by women, bisexual women who are battered by men. We're serving gay men. It's just, and so the gender justice for us is part of that work is making sure that every survivor, regardless of their gender and gender expression or gender identity, can get the support they need to feel safer and move away from violence in their lives and to have autonomy in their lives. So what the distinction that we're trying to make is between abusers and victims, as opposed to just relying on, like, we serve women, we don't serve men, because clearly that wouldn't work with the folks that we're trying to serve. At the same time, we want to hold out an analysis that says, yes, we serve everybody, and what we can see historically and from current research is that certain people, because of these structured oppressions, are more vulnerable to really negative consequences from incidents of violence and abuse than other people. So, and that has to do with the way that certain people are made vulnerable economically in terms of educational attainment, the way they're socialized to think if something goes wrong, it's their fault, not the other person's fault, that sort of thing. And so having an analysis about, like, what makes people vulnerable to abusers' tactics and is part of our gender justice analysis, and that has to do with sexism, and sexism is intimately tied up with homophobia and transphobia. So I hope that's making sense, and I'm not talking too much in circles, but that's something that we try to always keep in mind in our work, in all the work that we do.
Great.
Is that
Thanks,
my time,
Margaret.
Tammy? Yeah.
Yeah, and I just want to remind folks, if you do have questions or things are coming up, please feel free to use the chat box that's in the little box that's on your screen, because that's available. Great. So now, Christine, you want to talk a little bit about the disability justice work?
Sure, and I'm going to talk just specifically about what Alaska is doing about it, not what nationally what's going on. We're really blessed in our state to have the Alaska Mental Health Trust Authority, which provides a plethora of supportive dollars for different focus areas that impact what they call trust beneficiaries. And trust beneficiaries definition is individuals who experience developmental disabilities, individuals who experience mental illness, individuals who experience Alzheimer's or other dementia-related disabilities, individuals who experience chronic alcoholism and other substance abuse, and the last one is individuals who experience traumatic brain injuries. And so they have various different focus areas that where they're trying to improve the quality of lives for those trust beneficiaries. And one of their focus areas is called, as you can see here, the Disabilities Justice Focus Area. And so they have 8 different initiatives under the DJI for them. And under those under those 8 strategies that they have, only one deals with victims. The rest of them are all about recidivism, reducing recidivism for offenders who are their trust beneficiaries. So there's a lot of support put into the offender realm. And they recognized that there really needed to also be an area of focus for victims and the support systems that work with them. And so as you can see here, there's the strategy that we work under is defined as prevention and support for beneficiaries who are victims of crime. And 2 of those activities fall under where I work at the Center for Human Development. And just to make things easier, we just adopted that this is a continuation of the Disabilities Justice Initiative. And as you can see, our 2 activities is the Friendships and Dating curriculum, which we consider our primary prevention activity, where we created a 10-week course to be delivered via train-the-trainer to interested local communities who wanted to provide basically healthy relationships, appropriate social skills and boundaries, and understanding consent for individuals who experience rather significant developmental or intellectual disabilities. We know that those folks are, based on some of the statistics that we have nationally or internationally, is that they are at 90% risk of being victimized in some time of their life. And so we developed this 10-week course where it's done like in a classroom setting. We ask for 6 to 8 participants of mixed gender so that they can learn from each other healthy relationships. And then they actually go out into the community and do community activities that support whatever module that they're learning at that point in time. It has been exceedingly successful and popular. Individuals with disabilities who've participated in this have overwhelmingly stated that their natural support systems have increased, that they felt more included within the community because they're actually going out and not being just herded into a sheltered situation or a segregated situation that that some systems deem as a protective factor. If we keep them in segregated from the general population, then they'll have a less likely to be victimized, which is not necessarily the case. We also have what I manage is the Disability Abuse Response Team, which I consider secondary prevention, so that we look at individuals who they're disclosing their victimization, and that it's a coordinated community response that a community can respond to any allegations of victimization in a timely and an efficient manner. So in order for that to happen, you have to create teams that reflect the community and the supports that individuals access in their local areas. So our teams consist of the Victim Advocacy Organization as the lead organization, a disability or developmental disability provider, an independent living center. We really encourage that our teams have a representative from tribal organizations to ensure that there's cultural, everything's culturally appropriate, and we have a behavioral health partner. And so at any time, if any of those, that's the core team, if any of their clients say that they've been victimized to any one of them, they're able to quickly respond by calling the correct system that should be supporting that individual. And I'm very pleased to say that we have 7 teams across the state: Cordova, Homer, Nome, Anchorage, Ketchikan, Kenai, Juneau. Oh, we have 8 in Fairbanks. And then the third component of what disabilities justice looks like for under my purview is the Aspen, or Alaska Safety Planning and Empowerment Network project. And I, again, consider that a tertiary prevention. So, people have already been, they're disclosing that they have a higher prevalence of being victimized. Sometimes the biggest barrier for individuals are agencies that are supposed to be helping them, where they might screen them out because they're like, oh, well, we don't serve individuals with disabilities, we serve victims. So what we do is we conduct a very intensive, in-depth needs-based assessment in a community. And again, the partners that I mentioned in DART are the same partners that we recruit for Aspen in a local community. And so we do this needs-based assessment, which is awesome because we actually do focus groups of survivors of interpersonal violence, and then a separate focus group of different individuals with disabilities. So we each ask the partner agencies that we work with in that local community to conduct a focus group so we can ask their client base, what do you like about service delivery in your community, and what can be improved upon? So we're asking the constituency base, what can make things better for you. And then we also conduct, at the same time, key informant interviews of the organization itself to find out from board members, directors, and staff what they find helpful and not helpful in working to address victimization of people with disabilities. And then we do what's called a policy and procedure review. And so we look at their actual manuals to see, do you have a strong ADA policy? Do you have a strong workplace violence policy? And then we encourage them to share cross systems. And so that's how we're approaching disability justice here, because you can't just try to deal with one particular area. You really have to look at those various different primary, secondary, and tertiary prevention and work with them at the same time to be able to, I think, to see some effective change. And I hope that explains what we're doing here in Alaska.
Great. Thanks, Christine. And I see a question in the chat box about maybe further explaining what ADA stands for.
Sure. The ADA is the Americans with Disabilities Act, which is our federal law that protects individuals with disabilities from discrimination.
Great. Thanks. All right. And now, Darlene, we'll hand it over to you.
As I thought about racial justice, what I really went back to is just this idea of equity. And so when you think about racism, a lot of people go immediately to equality and the idea that everybody should have equal access to the same information, the same education system, the same healthcare system, the same kinds of access, equal for everyone. But that doesn't necessarily actually meet everybody's needs. So when you look at the illustration on the table or on the screen there, you can see that in the left side scenario, everybody is equal, but that doesn't necessarily mean it's equitable. So you look on the right box and you can see that the person who is already very tall actually gives his box to the person who is not quite as tall, and that's equity. That's what the base of what racial justice looks like. It's that we all who are invested in our communities, we all who are invested in making sure that we're in a society that is really caring for the people, understand that equality doesn't cut it, that equity means meeting people where they're at. And so when I think about equity, racial equity in Alaska, there are many different components that come into play. And, you know, like I said before, First Alaskans Institute has been working in the racial equity arena for a little while, since 2010, that's when we received funding. But we definitely do quite a bit of work and doing healing dialogues. And for example, I can just speak to several of the healing dialogues that we've hosted that are related to justice. So for example, Central Council in Juneau asked us to come out and host a racial equity dialogue with OCS workers and ICWA workers, judges, attorneys, everybody who's related to a case where a Alaska Native child may be involved. Now, one of the beautiful things about the type of dialogue work that we do was through the course of the day, and they did a great job of hosting that conversation. They brought in people who have been affected by the Children's Services system, grandparents, parents, children who lived through the foster care system, and they told their stories. And the beautiful thing that kind of occurred through the course of that dialogue was there was this moment of recognition of participants that the obligation of understanding the people that they're working with, the client that they're serving, the child who needs assistance, isn't on the ICWA worker. The obligation of talking about cultural relevance isn't on the one person. It's everybody's responsibility to understand the people that they're working with. So it shouldn't be a conversation of, okay, I am a person involved in this case, tell me the relevance or the importance of a dance group and why a dance group is important for a child to participate in. It should be a common, you know, if you're going to work in the community, if you're going to do this type of work, you should be learning about the value systems and the importance of the culture of the people that you're serving.
Great, thanks, Darlene. And I think that you all bring up really important points about kind of having a common understanding that people have experiences, and based on those experiences is how their identities kind of play out in their lives. So I think there's a lot of overlap and linkages there. So thank you. All right. So as we continue our conversation, we're going to be referencing a document that was recently released by the Centers for Disease Control and Prevention. I think it came out in June or July. And it's called Connecting the Dots, an overview of the links among multiple forms of violence. And kind of as the Pathways Statewide Steering Committee and other folks doing some of the violence prevention work, we've found that this publication can be useful in thinking about the intersections of oppression and the roots of violence and working with individuals but also with communities. So there's a link to this document. I will also share this document after the webinar with all of you as well. But I just wanted to at least introduce it so you get a sense of what we are going to be referring to. And I think it's also important to understand that while this is a good document, it doesn't have everything in it. There are clear things missing, and there are things that will just bring up good questions that you can start asking yourselves in your organizations and your communities and making sure that it fits for you. So if we look on page 6, there's a quote that says, professionally we have silos, and we operate in these silos we've got to break down. Across the country, people working to prevent child abuse are right across the hall from people working on violence against women, and they don't work together. As we go into communities to bring everybody to the table, don't let people say, I work on child abuse, but this is about gang violence. And don't let people say, I work on violence against women, and this is about child abuse. The thing is, all this violence is connected. So looking at talking to the folks on the panel, can you just share how you're seeing these silos play out in your work and what maybe you've done to help kind of break down the silos and work more in collaboration? And Christine, we're going to start with you.
Sure, and for us, we saw the silos like at the very beginning of our work about 10 years ago. It was just very clear. As I said, people were getting screened out of services because, I don't provide, you have a disability and I can't provide or accommodate you in our shelter, so therefore, we can't work with you, even though the person is coming to the program to deal with their victimization, not their disability. Or seeing disability providers being uncomfortable with kind of what they would consider sharing their dirty laundry, that clients are being victimized. They would do what the infamous incident reports versus really recruiting other experts that should be supporting that individual or providing counseling, which in my opinion is very dangerous to clients who are victimized because they don't understand power and control. So what we did, as I said, is we conducted these multidisciplinary teams, both with DART and Aspen, to make sure that there was this that there's no silo. and what we started to do to help break down some of the silos was when we convened a team, we asked them right away to define their common mission and values, to sit there and define their common language, and to literally outline and discuss how, specific activities and how they were going to work with each other with their common clients. And what we found was the biggest siloing effect, and maybe this is just really oversimplifying things, was language. It's like we both use the word clients, but we have a different definition of what that means. We both have, disability and victim advocacy have very strong confidentiality definitions, but how we go about it and the reason why we have it is also very different. So like for us, we always laugh, because before it was like, oh, I work in the disability field and I call a shelter to find my client, and then I get the infamous, I can neither confirm nor deny that this person is here, but if you'd like to leave a message, we gladly, do that for you. And, coming from the disability side, we were like, what, that's my client, I don't really understand, why this is an issue, until we had the conversation of why this was such, that confidentiality in victim advocacy was so crucial to, like, literally health and safety, that we were like, oh, okay, we understand that, but we had to sit down and define our common language, or have a better understanding, that what you have in your language box is a little bit different than mine. And so, people were afraid to not looking professional, or being, a master of all trades and a jack of all trades and a master of none. It's like, that's not part of my scope of experience. I work in disabilities, and what I really need to know is that if I have a client who experiences victimization, I don't need to know how to help them address that victimization on my own. I need to know who in the community can provide that for them and make that connection. And so when, and how we did that to start that is we didn't go around saying, oh, well, you're not providing this service for individuals with disabilities. What we went to victim advocacy organizations and say, here's what we can take off of your plate, because this is our area of expertise, and we would love to support you in common clients. And so that seemed to be a better way of, starting collaborative relationships by showing them what I can provide, not necessarily showing where they're lacking in providing a service.
Great, thanks, Christine. And Darlene, what about the work that you've all done to help break down the silos?
Just making sure I turned my mic on. You can hear me?
Yes.
Sorry. So, you know, I think one of the things that I'd just like to speak to is just the effect of some of the things that we've kind of heard already. So, I'm going to talk briefly about my family member. She's actually, I call her my mother, but she's actually my grandmother. And, you know, she's 86 years old, and she is still living at home. She has a caretaker in her home, living with her, one of her children, and she is often going to the hospital. She has disease that needs regular care that can't be provided at home. But she also has all of these kind of other things happening at the same time. And so it often happens, and I see this, you know, I see this in my mom's care, is that she will go in, and she's going in for a very specific reason. She's going in because she needs to get a medication, a shot of something. It's a part of her regular care. And she'll make mention of some other medical issue that she knows needs to be addressed, but because she's not there, she's there for a very specific reason, she's there to get a shot, that issue will be completely ignored. And I think that that's something that happens often as people are trying to provide services to folks. And just thinking about really being aware of the history of the people that you're working with, knowing what it is, what their values are, and recognizing that the values of either your organization or your own personal values might be in conflict with your client's values, and recognizing that. So for example, in business and in healthcare, the value of time is, the emphasis is on a clock or a calendar, whereas in culture, we have a value, the value of time is based around what's happening in our environment. So for example, fishing, you know, you don't schedule 2 weeks off in July because you think the fish might run. You have to wait to see whether or not the fish are running. So I think that one of the things that, you know, we as providers of services have to recognize is that our own value systems can potentially be in conflict with the values of the people that we're serving. And I think that that's the beauty of the dialogue work that the organization does. It gives an opportunity for participants to examine their values, examine the values of the people around them, or their bias, because we all have bias. There's no doubt about that. But just taking a minute to examine them, acknowledge them, and make personal commitment to changing the things that we can, be it an individual change, an interpersonal change, how we interact with others, or really focusing on systems.
Great, thanks. And I think you bring up a good point about like recognizing that we all have different values and we come from different places, and that we really need to think about whole peoples and whole communities to better understand that. So thank you. And Margaret,
Okay.
turn it over.
Yes, thank you. This particular quote brought up many feelings for me, having done the child welfare work, and given a lot of thought to what the disconnect was between the domestic violence field and child welfare field, for example. So I just have a number of thoughts about this. I'm kind of a big picture thinker, so I like to think like, how did we get in this place, and why is it so hard to get out of it? And one of the things that I wanted to bring up is I think sometimes one of the things that happens through siloing or maybe leads to things being siloed is that we have very different analysis of actually what the problem is. Like we might be looking at the same family, two different providers or, different people thinking, what's the prevention strategy for this family? They look like a mess, and have very different analyses for why is this a problem, how did it get to be a problem, and how do you fix this problem? So I appreciate the optimism of the CDC document and sort of the vision that is being put out there, but I also felt like we have to face straight on, like we don't always share an analysis of what's going on, and sometimes it is very uncomfortable to make that visible because there's disagreements, like when we're talking with our collaborative partners, And I know I found that in child welfare work is, my understanding of why a domestic violence survivor might be neglecting her child was really different than the story that the child welfare worker was telling in their mind about why this domestic violence victim was neglecting their child and what it had to do with the domestic violence. And that was and that manifested in some really serious difficulties of then trying to figure out what an action plan would be that would actually be helpful. I mean, we would go completely different directions. So I think that, to me, that is something that we need to watch for and to be able to say, actually, what theory are you operating on that is about this? And we need to back up and look at, like, what's our explanatory story about what's going on. The other thing I wanted to bring up, kind of a cautionary thing, is that we have to make a distinction between collaboration and coordination between, like, professional helping providers, whoever we are, and we have to be and collaboration and coordination when the individual in need wants it and where they want it. Because it's very easy for agencies and agency workers of various kinds to start working on coordination. It ends up being very paternalistic. And so part of the process of doing more coordination also has to really center, how does this really work for the survivor, not or for the individual, how do I think this works, or how should it work? But are we communicating with each other in the places and spaces that that are needed by this individual and wanted and welcomed by this individual, or are we actually, planning out this person's life in a way that takes away their sense of autonomy and undermines it? So there's kind of like the dark side of not being siloed, is when, a whole bunch of people are sort of trying to control somebody's life. So it takes, I think, part of the work of collaboration and getting out of these silos also is a mental discipline and an overt commitment to centering the autonomy of the person that we're trying to help and keeping listening over and over again to what that person is needing and asking, and not sharing more than is necessary to get that, because sometimes people just need their privacy in different parts of the community too. And they might not want everybody knowing everything about them if in the interest of getting them services efficiently, which kind of leads me to this other thought, which is that I think we exalt efficiency way too much in our culture, and that comes from our culture of unchecked capitalism. And that's one of the reasons why the dynamic that Darlene was talking about happens as well, which is that people only have so much time, right? And they're just like, click, 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 click. I'm here to give this person this thing, but that's not my job to help them with this thing, or they have to make a new appointment for that. And that's about efficiency instead of careful, loving, compassionate attention to an individual. And I think that when we're talking about helping people who are vulnerable and also creating conditions that are for prevention and creating community capacity, efficiency can't be the only measure of whether something's a good strategy or not. And we have to just realize, like, people are sacred and they take time, and that's just part of it. and resist that pressure from our funders and from the political conversation about that implies that every nonprofit thing that happens is inefficient, and that's what's the problem. So those are a few thoughts that I had. I also wanted to, I don't know, Cami, if I have any little bit of time left, but I think that that's the thing I really wanted to say, is making sure that our collaborations and our connections are very centered on the person who's requesting the help rather than the convenience of the agencies or the people that are employed to do that helping.
Yeah, I think that that's a great point. I think that oftentimes we don't look to the people that we're trying to reach for the insight and the expertise, but we know that their personal experiences and the experiences of a community can really inform the work in ways that those maybe who have the funding couldn't do, that would really resonate with the community. So I think that that's really important. And yeah, not looking through things, taking time to go through the process and make sure that it's a good fit for the populations that you're working for. Take time to make sure that it's working, and if it's not working, figure out why it's not working, talking with the community, and making those adjustments, I think, is really, really important. So thank you. Well, I just want to be mindful of time, and I know that we only have about 6 minutes left. So really quickly, we aren't going to have time to really go into talking about these, but I just want to make sure that you all see this and understand that there are shared risk and protective factors of violence, and getting to understand these can help prevent multiple forms of violence at once. And so, again, we aren't going to have time to really dive into this, but I want to make this available. Again, I'll send out this document. And if you have questions about how this is working, I'll give you the contact information for our panelists. But I just wanted to open it up to some questions if anyone had questions for our panelists about the work that they're doing or about any of these shared risk and protective factors. And feel free to use the chat box if you have any questions. Yeah, so Margaret, you typed in the chat box that you want to affirm that culturally specific specialized organizations are important players in these efforts to break down the silos. I think that's a good point. Thanks for sharing.
Tammy, Darlene.
Well, if you have questions, feel free to type them in. But going back to my three panelists, is there anything very briefly that you want to talk about maybe a suggestion that you have for folks to begin integrating multiple forms of justice work into their current work?
This is Darlene.
Oh, I have, this is Margaret. I have a kind of a thought or a story I wanted to share quickly. One of the things that we do at the network is we have a real ethic of engagement before antagonism. And so what that means is that when we feel like people are doing something in another organization or someplace else that is having a systematically negative effect on LGBTQ folks, for example, that rather than assuming that they're doing it, on purpose, or their ignorance is just, so distasteful we can't stand to engage with it, we just call them up and assume that they are operating from their best possible place and say, hey, did you know that when you word this thing like this on your poster, it kind of sends this message to LGBTQ folks? And I mean, is that what you're hoping to do, or are you hoping to get a different result? And just engage it in a very friendly way. And what we found in doing that is that it's provided a model for talking about the sort of mistakes that inevitably happen around social justice work and in these collaborative partnerships. And we've made ourselves as an organization a very safe place for people to consult with and, admit their learning processes with. And now people sometimes are like, hey, can we run this thing through you before we print it up or whatever? And we're like, yeah. in that kind of spirit of cooperative, collaborative, assuming the best from each other and trying to keep the intent and the mood and the relationships on a real positive level. And that has been really effective for us in facilitating justice making and more access throughout our community for LGBTQ folks. And sometimes it takes a lot of work because it's really frustrating. But in the end, it's worth it for what it gets us.
Great, thanks. And so I see a question for you, Margaret, about what steps to increase community readiness for LGBTQ justice work?
Yeah, I'm not sure I totally get the question, but I think that one thing that people can do is try to identify who is out on a limb on these issues and get next to them and support them, and start backing up who is taking a risk out in your community on those issues, and just back them up as the beginning point, and then own it that, like, LGBTQ people are disabled. LGBTQ folks are indigenous. They're people of color. They're like, we're everybody, and so it's common cause for all of us to increase access and make safe spaces for folks in those communities, and it's common cause for LGBTQ organizations to make sure that they're racially diverse and that they have, that they're accessible in all those ways as well. So starting those dialogues and having each other's back out in the public realm when people are stepping out and saying, hey, we need this or that, is an important thing to do.
Great, thanks.
This is Christina. I just wanted, my only imparting thought that I wanted everybody to really hear is that you are not alone in your communities and in the work that you do. You have colleagues and counterparts in different systems in your communities that would love to partner with you, because it makes everybody's ability to provide excellent work a lot easier. And it also provides the individual that you're supporting that they have a community behind them, not just one savior that can help them access safety. And so I just really, I know that Tara had asked, about the friendships and dating class. If any of you are interested in the programs that we support here at the center, please don't hesitate to call me, and I would gladly like to connect you with any of these activities to help you with the awesome and incredible work that you do.
Great, thanks, Christine. And Darlene, do you have any last minute?
I'll get back to it. Yeah, am I online again?
You are, yeah.
Great, wonderful. So I just want to reiterate some of the things that have been said by others. Finding like-minded people or finding ways that you can support other communities is important. Making sure that you're checking in your own mind as you're thinking about how you can be supportive of other groups. What your internal bias might be, acknowledge it, recognize it, and make sure that you're working through that as you're reaching out. Finding like-minded people to be around you, even if they might not be people that you would customarily reach out to, is a really great way of building grassroots effort around making social change.
Great. Well, thank you again to our panelists, and thank you to everyone who called in today. And again, if you have any questions, the contact information for all three panelists is up on the screen, and I will share that as well in an additional email. So thank you so much, and everyone have a great day.